I'd like to go over how we do the Swiss Dent overdenture system with implants. Today you're going to actually see a patient, we're just finishing her case literally today, where we placed upper and lower implants, and then what we've done is we've made the Swiss Dent denture system that actually plugs into these implants. The advantage of this system is with the implants you can literally chew the way you want to chew, like when you had your natural teeth, because we're going to look at your facial profile, we're going to look at how we want to build your lip up, how we want your lip support to be. It almost looks like we've done cosmetic surgery, but it's without surgery. It looks that good. Now what you're going to see, and we see a lot of this when people have dentures, is the teeth aren't set like real teeth. So for Angela, bite down Angela for a second and just show how you close and with your lips touching, and bite all the way down. If you look, Angela is overclosed. She's a young person, but what we see with a typical denture, if it's not fabricated correctly, if it's overclosed, a denture can really aid you, because when you measure from the tip of the nose to the chin, there is what's called a vertical dimension. And if it's overclosed, a denture system can really aid you. So you're going to see when we did the Swiss Dent overdenture system, we opened up Angela's bite. We also, if you look, Angela, just relax and close, please. You're going to see for somebody this age, which is a young person, her face is collapsed, because if you don't pay attention to how the facial profile should look after you lose the teeth, and the laboratory technician doesn't get the proper information to place the teeth, they'll always place the teeth over the remaining bone. And what happens many times is the whole face collapses, and that's why a denture can literally age you 10 to 15 years. That's what we're seeing here. We've got a denture system that's overclosed, that's aging her because it's making her cheeks collapse. We have a denture system that's not taking into account that the bone is collapsed, so her lip is too far back, and that's aging her. Also, if you look, Angela, smile if you would. You see how the teeth, if you look, the teeth are set flat. 90% of the patients that come in, when they present to me, either they want a custom denture or they want a Swiss Dent overdenture system with implants, the teeth aren't appropriate for the size or the sex or the age of the patient. So you're going to see what a difference it makes if we use the proper teeth, and then we also give the proper profile to the patient. And that's what you're going to see on the new denture system. So what I've done is I've inserted the upper Swiss Dent denture system to the implants, and now what I'm doing is placing the lower Swiss Dent, and what's going to happen, it actually plugs into the implants, and it plugs in so tight we almost can't get it out of the mouth. Let's see the dramatic change we have. What gives you a beautiful smile is you want to show all the teeth, you want to have most of all the teeth showing, but never the plastic. So when a lot of people come in with denture systems, one of the mistakes it's making is when they smile, and if you have a denture, you might have a denture that has this. Every time you smile, the plastic shows, and it's a dead giveaway that you have artificial teeth or a denture. So there's a way of measuring the high smile line that when you smile, you're never going to show the plastic, but you're going to show the Swiss Dent teeth. Just look at the difference we've made in the cheek. So we've stretched the bite, we went back to how she was naturally had her vertical dimension, which she had her natural teeth, so now she's not overclosed. What's nice with the Swiss Dent denture system is we do a lot of fillers with Juvederm and Restylane in our office. And when we do Juvederm and Restylane, it lasts about 8 or 9 months, and then we have to do it over again. What's nice with this system is we can build up the facial profile, and it never goes away. And that's why we call it a non-surgical facelift, because we can really alter the facial profile and it never goes away. You know, one of the things I want to show is, you know, with the best fitting denture, with the biting studies that we've talked about, you maybe get 20% of the chewing power if you've got ideal bone. So I want to show in Angela how tight we can actually make this. This is what we're trying to accomplish. I'm actually going, that's how tight this restoration is. This is why you can eat corn on the cob, steak, any kind of food you want, because this thing won't move. If you have a lower denture, you know how one of the hardest things to fabricate for a patient is a lower denture, because at least with an upper denture you get a little bit of suction. But on a lower denture, because of the anatomy, all you really have is a little U-shaped piece of bone. We have patients that come in with multiple lower dentures that never fit. This is the lower denture. This is the lower, and this is how tight this overdenture is. So we've got 2 restorations that we've made for Angela. That's how tight it is. So you're going to finally get to see what we've been trying to accomplish for you over a little bit of time, and I think this is going to be an exciting moment for you. So are you ready?
Yes, I am.
Let's take a look.
Oh my gosh.
Beautiful smile, isn't it?
Yes.
Yeah. You've been telling me, I think you lost your teeth in your 20s. And
8 years.
8 years. And so now we're going to go back to the time when you had the chewing power of your real teeth.
Wow.
So I think it looks beautiful.
Yes, I'm excited.
Yeah.